Hello, good morning. How are you all? Um, Respected Professor B. Valli Madam, Principal, College of Nursing, Kurnool, and Head of the Pediatric Nursing Department, Dr. N. Kalavatama Madam, and respected other dignitaries present in the session, and all my dear participants, a warm good afternoon. I know that Miss Syamala already introduced me, and I want to give a brief update on myself. My name is Sudha Rani. I'm an old graduate from College of Nursing, Kurnool from 1994 to 1998, 23 years ago, which I'm very proud of. We started working from 1999 June. I worked in India for 3 years, and after that I came to US in 2003, and I worked as an RN, registered nurse, for several years in different departments. I worked in pediatrics for a very brief period, for very most of my experience was in cardiology, and I completed my master's from a decent, a famous university, Northwestern State University, in 2015, and I've been practicing as an advanced nurse practitioner in Department of Justice, Bureau of Prisons, for past 6 years. So Samala is one of my best friends, an undergraduate. She's a very sharp and little rebel, I would say, and she is very close to my heart. Um, let's coming to the topic. I'm going to discuss about. You already heard about a lot of things about COVID-19 for past 1.5 year. COVID-19 in children and advanced nursing practices and myths in US. Not only in US, we will discuss in the whole world. Um, I want to give a brief introduction first. I know you have heard about it all. All the other speakers might have already said all this. Coronavirus was first reported in Wuhan, China in December 2019, and since then it has rapidly spread from China to Asia to Middle East and Europe to the entire world. Now WHO announced it as a pandemic now. Um, who do we get? We have a question: does children get COVID-19? Yes, of course, children of all ages can get COVID-19, although they appear to be affected less frequently than adults. COVID-19 in children is usually mild, although severe cases have been reported, including cases with hypotension and multi-system involvement in series of children with COVID-19. But most of the kids have either no symptoms or very mild symptoms compared to adults. Symptoms include shortness of breath, fever, cough are the main symptoms. But other than that, they have shortness of breath, body aches, which is myalgia, rhinorrhea, headache, nausea, vomiting, abdominal pain, diarrhea, fatigue, loss of smell and taste. But usually loss of smell and taste is very non-specific symptom. It's usually, mostly you will see that in adults only. It's only 1% in the children that you see that. Um, with this, we already discussed children, particularly those younger than 12 to 14 years of age, appear to be affected less commonly than adults. Although children typically have a lower risk of exposure than adults and are tested less frequently than adults. When you talk about children in US, children is pediatric department is under 18. I believe in India it's less only until 12 or below. Here it's 18 or below. When you have a question of whether a fetus, I mean, when the baby in pregnancy, like whether COVID mother will transfer the COVID to the child. There is no definite evidence for SARS-CoV-2 crosses the placenta and infects the fetus. However, a few cases of placental tissue or membranes positive for SARS-CoV-2 and a few cases of possible in utero infection has been reported also. How does it distributed in the children population? As the age grows up, the incidence is going to be more. Preschoolers is 17%, middle school between age 11 through 13 is 18, elementary school it's more 25%, and high schoolers it's 38%. So as you grow older, the chances of getting COVID is more. How do children get the COVID-19? It's mostly household transmission. If an adult is suffering with a COVID in the house, of course, he's going to pass that infection to the child. And also, this will be transmission in the educational or child care settings. When the kid goes to school, of course, it can come from other students or the teachers or other staff. Anybody could transmit the COVID-19, especially because most of the children are asymptomatic. So what are the clinical findings? Especially the symptoms of COVID-19 are similar in children and adults, but the frequency of the symptoms varies. It is more intensive in adults compared to the kids, but mostly all the symptoms are the same. Those include, as we already discussed, it's fever, cough, shortness of breath, myalgias, rhinorrhea, sore throat, headaches, nausea, vomiting, abdominal pain, diarrhea, and loss of smell and taste, as it's only 1%. And how do we detect COVID-19? We do some tests, what are the inflammatory markers in the regular settings, the ESR and CRP, right? So in this condition, the CRP and ESR is going to be elevated. Also serum ferritin, lactate dehydrogenase, D-dimers, procalcitonin, and leukocytes are elevated. Lymphocytopenia, you will notice, and lymphocytosis, and also elevated creatine kinase myocardial bands. Another thing which is concerning is in children there is a multi-system inflammatory syndrome which is called MISC is also observed, especially it's similar to those Kawasaki disease. What is Kawasaki disease? Is the symptoms of the Kawasaki disease include persistent fever, hypotension, gastrointestinal symptoms like nausea, vomiting, diarrhea, rash, myocarditis, and laboratory findings associated with increased inflammation and respiratory symptoms. All these also, it is almost similar to that, like all multi-systems are involved. GI system, respiratory system, neurologically, all that is going to be affected. When do we test them? When you have symptoms for the kids, like, all these symptoms that we discussed, yes, of course, you're going to test for SARS-CoV-2. So here the main topic is how, as a nurse, what can we do to help the children and also the society, or how we are going to help the people basically. What are the nursing practices that we can do for anti-COVID-19? So there are 5 domains. First of all, the first domain is providing health education. So as a nurse, what is the best thing that you do? Doctors will manage, they'll give the medications and they will treat the patients. But ultimately, we have to have some knowledge about all these conditions, and it's everything. We are almost like physicians. Here, if you practice as an advanced nurse practitioner, you're nothing but a physician, of course, except you don't have that MD next to your name. So basically, you're going to teach. Teaching is the best thing that we could do to help the patients. When they're children, if they're old enough to understand what it means, you can teach the kids. If not, you can teach the parents in the pediatric setting. Teaching about washing hands regularly and avoiding touching your hands to most of the people, they usually automatically their hands will go to their nose and mouth. You need to tell them you have to avoid touching the eyes, nose, and mouth, and wearing mask all the time, and also early detection of, and also infection signs, and preventing and early detection is most important. And also, if the kid is going to the group activities, you have to prevent that, which we already did. And also communal dining, you have to prevent that. And also screening services focuses on screening individuals for potential infections, whereas support focuses on providing emotional support to those isolated because of COVID-19. So when the kids are isolated, you have to provide emotional support also. The second domain is nosocomial infection prevention and surveillance. So hospital infection, how could a nurse can prevent a hospital infection? By implementing standard precautions like hand hygiene, respiratory hygiene by wearing the mask, social distancing, and also wearing personal protective equipment. When you take care of one patient, you wear head to toe personal protection, and then automatically when you go to the next patient, you have to discard all of this, hand washing and do standard precautions and go to the next. So in that way, you're not bringing a virus from one patient to another patient. Also educate and train the patients and families, parents, especially parents in a pediatric setting, and healthcare staff to prevent nosocomial infections. Healthcare staff are nothing but your colleagues or your co-workers like ward boys. And if they don't know if they're practicing something wrong, of course you can stop them and say, hey, this is not right, this is how you have to do it. As an educated nurse, yes, of course you can tell them in a nice way. Furthermore, nurses implement isolation care and monitor, provide supplies to conduct fever and respiratory symptoms assessments. The third domain is implementing appropriate preparations and precautions in nursing homes. I mean, this is not particularly for the pediatric. It will apply to the older population. But what they're saying, you have to apply all these precautions to the other groups of the patients also, not only the pediatrics. The fourth domain is the protection of the patients with immune deficits and underlying diseases such as COPD, chronic illnesses, and cancer. These patients face significantly higher risk from COVID-19. When a child is diagnosed with cancer, of course, they have less immunological deficits, immune powers, so you have to protect them from the external causes, and you have to prevent it from, because they're going to go into very grave symptoms if they get COVID-19. The fifth and final domain is providing care to patients with COVID-19 who are in acute or critical condition. Now, COVID-19 may induce severe pneumonia and even lead to mortality in every age group. It's not only for adults, mostly we hear about adults, but it is for the every age group, with the highest risk groups including older adults and individuals with immune deficits. So ensuring that healthcare providers are fully protected by adequate personal protection equipment is necessary to prevent them from becoming infected. So what are the challenges that the nursing professionals are facing during COVID-19? Providing support to reduce gaps in critical knowledge. Of course, as we discussed, we can teach the parents, we can teach colleagues, we can teach your subordinates, we can teach everybody about the preventive measures, and preventing inadequacies in the healthcare system, policies and strategies to prevent staffing shortages, psychological and social support to the patients, and research to enhance knowledge on COVID-19 prevention and management. What are the myths about COVID-19? COVID-19 vaccine isn't safe. So a lot of people in the first few months back, I heard that when there were a lot of COVID vaccines, a lot of people in India actually rejected the vaccine, thinking that it is not safe. Usually, even educated nurses, educated people were not even taking those, thinking that vaccine is usually has to be studied for at least 4 to 5 years. How come they have created the vaccine within less than a year? Yes, of course, FDA has undergone all the precautionary measures and it is pretty safe. So which is not safe is a myth and it is wrong. Yes, it is safe and everybody can take it. And another myth, it would be I can get COVID-19 from the vaccine, which is absolutely wrong. you would not get the COVID-19 from the vaccine. Vaccine contains only mRNA, sugars, and other proteins. You're not gonna get those. So actually, I was reading this here. So what vaccine does is it's going to teach our immune system how to find the virus and how to fight the virus. And the third myth is the side effects of the COVID vaccine are dangerous. Yes, after intensive testing and all that, there are millions of people who are vaccinated, and there are a few side effects like body aches, headache, fever, chills, and tiredness, which usually actually for me it lasted only the body aches and regional pain for that on that spot only for half day. And the fourth myth is I have already had COVID-19. I don't need a COVID vaccine. No, you can get the vaccine after 90 days of the infection. So you can get the vaccine after 90 days, after when you recovered. And another myth is after I get vaccinated, I no longer need to wear a mask, which is not right. Researchers have not determined if the COVID-19 vaccine will prevent you from spreading the virus. So of course you have to wear the mask even after you're vaccinated. And another myth would be the COVID-19 vaccine can change my DNA and contains harmful substances. No, because COVID-19 vaccine is an mRNA vaccine, which is actually the DNA is inside the nucleus. In the cell, DNA is inside the nucleus, mRNA is outside. It cannot enter into the nucleus. So of course it cannot change your DNA. The vaccines do not contain implants, microchips, or tracking devices. So basically that's all about the myths, and I think I am done. The conclusion is the rapid spread of the COVID-19 poses a serious threat to the human health and is impacting severely on the public health, global communications, and economic systems worldwide. So the immediate efforts to control and prevent the COVID-19, to take care of those who remain infected, remain ongoing. And prevention is the main thing, basically. So that would conclude my presentation. And I'm thankful for this opportunity. I am thankful, Ms. Shyamala. Thank you so much.